In '09, I had breast cancer.
She had 2 lumpectomies, then she had a mastectomy, and then the cancer spread to her bones.
My brain is going bad. That bothers me more than anything. I don't want to live on and on with my brain just getting worse and worse and worse.
Putting it bluntly, she'd rather die from the cancer than from the Alzheimer's. She doesn't want to get into that vegetable state, and that just is not living.
It's your life and you have a right to do it the way you want.
End-of-life care is knowing patients' wishes, values, what the patient think that they can accomplish. We need to be able to explain the treatment options that are aligned to that wishes.
The main thing we want our patients to know is that they can talk about their concerns. It's emotional, it's scary, it could be sad, but it could also be really joyful. When people get to start talking about how they want to spend their lives, what kinds of things they want to make sure they do, what do they want to make sure they say before they go. Time is perceived differently depending on the circumstances. If I've only got a year to live, that's going to be a really different reality for me than someone else.
What are my wishes? Well, I hope to get up to the island this year for a grand finale. I know I'm going to be dying, and it's more comforting to me to be able to talk about it.
It's important to open up and explain your feelings to people and discuss the situation rather than trying to hide it.
Being able to have some choices about it is really what we're about, is letting people have the resources they need to discuss it so that they can make the choices that are best for them.
We tend to want to fix everybody, so that's sort of our personality. You have to balance that with, hey, you know, what's right for the patient and what does quality of life look like? Being able to offer patients kind of both sides, helping them make a decision rather than making decisions for them is one of the more important things.
I ask not to have a lot of stuff done to keep me going, because when I don't feel good about it, if I'm feeling dizzy and things of that sort, that's no way to live.
I think a smart doctor would realize that the best thing they can do is have them die in an appropriate manner without pain.
Some people are good at having those discussions, and I think others, it's a little more challenging. The chaplains can come help with those conversations, so there's definitely help available.
I like to understand why they're doing this or why they're not doing this, but I don't want to run away from it. And that makes it a lot easier to die.
The patients are the guides, always. They should be. Letting the person who's going through it be the guide. The ones that don't want to talk about it don't have to talk about it. That's their right. But the ones that do need to know we're here. There are people that are here to listen. Somebody's ready somewhere to talk about it, I promise.